Hello, my name is Katerina Gapon and I am a medical doctor from Ukraine. Today we would like to discuss with you NAC OSCE station for anorexia nervosa. We would like to share with you some tips and tricks on what questions to ask, how to build a conversation, how to answer examiner's questions, and I will also like to share with you a checklist for anorexia nervosa, and then hopefully you will score the highest score possible on the day of your exam. So at first, what is the most important tip and trick to score the highest score possible on the day of your exam? It's practice. So find good partner, smart partner, active partner, who is full of energy and can share with you that energy, so you can practice as many hours as possible. The second thing, you have to know all the high-yield topics, and about these cases you have to build your knowledge and you have to know why you're asking every question you ask, right? What do you want to achieve? What do you want to know by asking such question, right? So today we're discussing anorexia nervosa, and when we take a look at the epidemiology, we can see that females are more prone to develop this disease. Therefore, on the day of your exam, you're going to have standard patients. So most probably for anorexia nervosa, it's going to be a girl, a female. Usually they are teenagers, right? So now you have to remember what specific questions you have to ask teenagers population, right? Also, why this topic is important, because among all psychiatric disorders, anorexia nervosa has one of the highest mortality rates, and you have to show that you know this disease, you know how to manage this case, you know how to help this particular person on the day of your exam. Okay, so we have to know diagnostic criteria for anorexia nervosa before entering the station. So please memorize the diagnostic criteria, not only for anorexia, for any disorder which is high yield during the NAC OSCE exam. And let's take a look at the criteria provided by UpToDate. So the first one is restriction of energy intake that significantly lowers body weight of a patient. So the BMI of the patient can give us an idea of the severity, right? The second thing is intense fear of gaining weight or becoming fat, or persistent behavior that interferes with weight gain. The third thing is disturbance in the way in which one's body weight or shape is experienced. Persistent lack of recognition of the seriousness of the current low body weight, so lack of insight, obviously. And there are two types of anorexia nervosa, which are restricting type, like more than 3 months person will tell you about dieting, fasting, excessive exercises, and binge eating or purging type, which means the use of laxatives, diuretics, enemas, and other stuff, also more than 3 months. So important time frame is 3 months. Before entering the station, on the door, you're going to have your task, which you have to read carefully. Sometimes they provide us with vitals of the patient or some other important information. So please write down the vitals, important stuff, so then you can enter the station and you can be prepared. Usually they give you, for example, in case of anorexia nervosa, they give you vitals, they give you BMI of the patient, so then by the end of the station, they're going to ask you, do you think you have to admit this patient, or how are you going to manage this case? So no criteria for admission. As per UpToDate, there are no evidence-based criteria indicating which patients with anorexia need initial hospitalization. However, they suggest hospitalization with any one or more of the following: pulse less than 40, blood pressure less than 80/60, orthostatic changes in the patient, cardiac dysrhythmias or any rhythm other than normal, cardiovascular, hepatic or renal compromise requiring medical stabilization, marked dehydration, serious medical complication of malnutrition such as electrolyte imbalance, hypoglycemia, or syncope, BMI less than 40 or less than 70% ideal body weight, refeeding syndrome, poor response to outpatient treatment, or major recent and rapid weight disruption, even when current weight is not severely low. So know about these criteria. You have to screen your patient for all of these criteria, and you have to make a decision during your station whether you're going to admit this patient or you're going to manage him as an outpatient. For instance, this is the way how your task can look like on the day of your exam. You're going to have only 2 minutes to prepare, so make sure you have a notebook and a pencil that actually works and you can make notes, right? It should be provided on the day of your exam by people who organize and show you where to go, how to proceed, and what is your next door that you have to knock in, right? So let's read. You're a family physician working in a busy walk-in clinic. Monica Bell is a 16 years old female who was brought by her mother to your office due to her weight loss and fatigue. Here you have BMI, temperature, pulse, blood pressure. Make sure you write down this information. Make sure you know the name of the patient, the age of the patient, and the main complaint, right? And 2 types of stations. So for this particular case, it can be 8-minute station where we have to take a focused and relevant history of the presenting problem, right? And another case is a counseling station where you're gonna have 11 minutes. Very good advice is, please, when you are preparing with your partner, prepare every station not for 8 minutes, but make sure you can complete your tasks in 7, right? In 7 minutes. And for counseling, make sure in 10 minutes, not in 11, but in 10, you can provide the best counseling ever for your patient. So that will help you a lot on the day of your exam. Then make sure that during these 2 minutes you can write down a plan. So what you're gonna ask the patient, write down abbreviations, know them very, very good. Always practice for each case, like what can be the diagnosis, what are the differentials, write down the differentials. For anorexia and nervosa, I wrote eating disorder, right? So then I can screen which one exactly. Depression, thyroid issues, inflammatory bowel disease, malignancy, or case of abuse, which is also important, and you have to put it into your differentials and screen for that. And other important abbreviation, because you never know how your station turns out. Sometimes it can be case of pneumonia, and then you end up asking patient about asthma or malignancy or any other, right? So write down the plan in advance. So I put here, make a note about vitals, build trust with the patient, OCD, PQRST, COCA-B, ROS review of system, constitutional symptoms, AMPL-F, SAD, SOTS, sex, MOAPS, psych, MCAPS, HADS for teenagers, SAD persons for suicidal risk, and last menstrual period for this girl. You always have to ask questions about gynecological questions in case you have a female on your station, right? And also here's an example of differentials that you can use. You can use whatever examples you want. It's better to put some organic cause in case of psychiatric condition into your differentials, and to ask questions to exclude these conditions. So in the previous slide, you saw how it can be how you can write down all this abbreviation on your in your notebook and use, so you will never feel lost during your exam. You will know what question is the next, what should you ask, what you haven't asked yet, and you will proceed right to these questions. So basic questions, always ask if patient is comfortable, provide reassurance, especially for such cases of abuse, violence, psychiatric conditions. Like, we always have to provide our patients with reassurance that we will not disclose the case of this patient to anyone unless it is requested and or required by law to be disclosed, right? Then again, so the examples of abbreviations that we can use. Very important abbreviation for teenager, which is HADS. I personalized it a little bit and I'm sharing it with you. You can extend it however you want. You can add whatever you want, just to contribute your performance. Do whatever is possible, right? So HADS, which is home environment, school activities, appetite, drugs, alcohol, smoking, depression, diet, suicide, sleep, sex. So you will not miss anything. Even if you feel lost, you remember HADS for teenagers. You can proceed, you can ask, so you will still score based on the checklist they have, and I can reassure you, for teenagers, they should have that in their checklist. If you still don't know the diagnosis, if you feel, oh my god, I'm gonna lose the station, always ask MOAPS. Maybe that can be in their checklist as well. So MOAPS, quick psych screening, which is mood organic causes of the condition, trauma, drugs, and others. Anxiety, psychosis. Do you hear things that others people don't? Do you see things other people cannot see? Always ask about some suicidal and homicidal thoughts and ideation. If you're suspicious about the presence of depression in this patient, use mnemonic PsyG MCAPS or MIPAS ECG. Lots of mnemonic you can find. You can create your own. So PsyG MCAPS is sleep, interest, guilt, energy, mood, concentration, appetite, psychomotor, and suicide. I also decided to add mnemonic set person for you to know how to assess the risk of suicide in this patient. You can Google it and familiarize yourself with this mnemonic and how to use it. And here is a checklist for anorexia nervosa that is, it's my own opinion, I think it's the most appropriate. So make sure you knock the door when you enter the room, you greet the patient appropriately, you know that this can be psychiatric case, so behave appropriately, right? And try to build trust immediately with the patient. Use your body language, use your tone of the voice, be nice, reassure the patient that here is a safe place and you'll do the best possible to help this patient, right? So greet the patient appropriately, made a good rapport with the patient, reassure about confidentiality. What brought you in here today, right? What does her mom think about the situation? Because you remember, the mom of this patient brought her to you today. You can also ask whether your patient, if they're together in the room, you can ask whether your patient feels comfortable discussing the case and answering your question when mother is present. Otherwise, you can ask mom to leave the room nicely, right, and politely, and to have more private relationship with the patient. Maybe sometimes they're hesitating to share with you some concerns because others are present in the room and they don't want them to know about this, right? So we can ask, what does her mom think about this condition? What are patient's thoughts about this condition? So we can check her insight, whether she thinks she has a problem, she has a disease, and whether she wants to get some help based on this situation, right? How long has she been losing her weight? How much of weight lost? Still wants to lose weight? What methods does she use? What is her current weight? What is her current height? Maybe she knows her BMI, otherwise you can calculate it yourself. And what was her maximum weight before? These questions are crucial. Don't forget to ask them. So what is her target weight? Does she lose her weight alone, or she also has a partner? You know, sometimes they connect via social media with other people, or maybe she has a friend from school and they're doing that together. So you know, you have already two people struggling and suffering from this disease, and you need to act appropriately, right? Whether she has fear of being obese, you remember, it's among the criteria for diagnosis. Does she think that her eating pattern is normal? Again, insight. Describe what she eats in breakfast, lunch, and dinner. Know exactly. Did anyone tell her that she was fat, or just it is her own idea? So you can already investigate relationships and maybe someone bullied her at school, right? So you're screening for bullying. Does she feel guilty if she eats? Very important question. They do sometimes feel guilty when they eat, and they try to overcome that feeling. That feeling is really, it kills patients. What is she preoccupied with? Does she avoid eating? Does she count her calories? Binge eating at any time. You remember different types of anorexia. Vomiting after binge eating. So these are coping mechanisms. Also, did she use laxative at any time? Does she exercise? What does she do when exercise? How many hours per day? So we're checking for excessive exercise, right? Other symptoms associated: weakness, lightheadedness, shortness of breath, cramps in muscles, hair loss, nail changes, lack of energy, mood disturbances, suicidal ideation, intolerance to cold, dry skin, nausea, vomiting, diarrhea. Also, during this set of questions, try to ask questions from your differential diagnosis, right? So you can exclude other differentials. Very important questions: last menstrual period, menstrual irregularity or missed periods. When does she ever had menstruation? When was her last menstruation? Any changes? For how long she has no menstrual periods? These are important questions. 100% they will be in the checklist. Also, ask about meds, laxatives, diuretics, meds causing weight loss. Sometimes they can buy medication on the black market and take it, and that helps them to lose weight. Also, family history. Anyone in the family with the same condition, brothers, sisters, history of psychiatric conditions in her family, questions from HATS, home situation, education, any drop in marks, is she a higher achiever, activities and hobbies, with whom does she spend her free time, drugs, any street drugs, alcohol, sexually active, has a partner or partners, any breakup recently, do you feel that you are treated with respect in this relationship? So it's an important question to screen for abuse, especially in relationship with her partner. Don't ask boyfriend or girlfriend, or just say partner, which is an appropriate way to ask about sexual relationships in Canada. Also, suicidal ideation, ask about childhood history, any psychiatric condition in her childhood, ever been abused in childhood, sexually abused, which is a risk factor for psychiatric conditions. So these questions are specifically about anorexia nervosa. All other questions, which are basic, they were at the beginning of this presentation. You can go back and check and add into your checklist, your personal checklist. Then, after the end of your session, there will be a few minutes when examiner gonna ask you his or her questions. So usually they ask, what is your working diagnosis? When they ask you about the working diagnosis, you say just one, okay? The one that you consider in this particular case, and you were able to diagnose this patient during your conversation with him or her or them, right? Then 100% they're going to ask you, what are the indications for admission in case of anorexia nervosa? Are you going to admit this patient? And now you can look at the vitals, and based on the information you got during your conversation, you can make such decision, right? And very important question to know in case of anorexia nervosa is refeeding syndrome. Also, how do we diagnose anorexia nervosa? History, physical exam, and lab blood testing. All patients with anorexia nervosa should receive an initial set of serum electrolytes: blood urea nitrogen, creatinine, glucose, calcium, phosphorus, magnesium, albumin, prealbumin, liver function test, international normalized ratio, complete blood count, thyroid stimulating hormone, 25-hydroxy vitamin D, electrocardiogram, and urine analysis. And now let's check on up-to-date what is refeeding syndrome to be able to answer this question, and it will be asked. So the refeeding syndrome is defined as the clinical complications that can occur as a result of fluid and electrolyte shifts during aggressive nutritional rehabilitation of malnourished patients. These complications are potentially fatal when not detected or treated early during nutritional rehabilitation. Right? So what is the treatment for anorexia? It is food. Right? So when we start to give food to our patient, we can have such consequences of this, which is refeeding syndrome. So it is marked by hypophosphatemia, hypokalemia, congestive heart failure, peripheral edema, rhabdomyolysis, seizures, hemolysis, and respiratory insufficiency. So in case if you have a counseling station and in the task you have written, during your station I address the patient concern, please make sure you ask your patient what kind of a concern you have that you would like me to address today during our conversation. This is a crucial question. Don't forget to ask it, write down it, okay, and make sure you answer it, right? Because in counseling stations, you have to allocate some time to take some history and then to address the concern that patient has. So some useful mnemonics that you can use for counseling, it's gather, greet, tell, help, explain, and return. Check their understanding and that patient actually understands the information that you provided to him, okay? And key elements can be memorized by using mnemonic client. So your approach should be client-centered. Interaction with the patients, the best way of counseling is conversational counseling. When patient asks you, you answer, you check for understanding, you check for knowledge, and you address the concern. Exploration, you explore, you are non-judgmental. For instance, we had a question about sexual relationship, so you don't ask girlfriend, boyfriend, especially, sometimes if you have a station about abortion, you should not be judgmental. Stations about violence, home abuse, you should not be judgmental. You give your patient an option to make a decision and to proceed, right? But you don't judge them. And trust. You have to build trust with the patient. You have to convince them that this is a safe place, that you'll do the best to help him or her or them. And this is the place when they can ask for help and they can share any concerns they have. And you'll do your best as a medical professional to help them. So how your counseling part can be built during your counseling station. For instance, this condition is called anorexia nervosa. Ask about patient's knowledge about this condition. Explain what is anorexia nervosa. Your weight is much below the average. The best treatment is food. Consequences of anorexia nervosa if left untreated, right? So they have to know about that. Other features of anorexia nervosa: verbal consent for treatment. You have to obtain a verbal consent for treatment if person has an insight. If they understand they have this condition and they want to proceed with their treatment. Otherwise, there are different mechanisms how we can help. We can offer family meeting. Family therapy is one of the most effective for the treatment of anorexia, right? So then we create safe environment. We create the place where patient feels safe, not only at your office, but at home as well. And they feel supported. They have this social circle around them when they know they can get help and they are understood by their family members. And for sure, make sure you set up a follow-up. You want to check on your patient. You want to take care of your patient. You are the one who will support and who will help to take and go through this path of recovery, because anorexia nervosa, it's like very hard condition to treat, and you have to make sure that during your station you've done everything possible to help this patient. You remember the mortality rate, which is the highest among all psychiatric conditions. Anorexia really kills people, and we are, as medical professionals, have to do everything possible to help these patients to raise an awareness and to contribute into their recovery. We also have to discuss treatment options available for this condition. For sure, if patient is unstable, we have to stabilize him or her or them. So we have to admit, right? For patients with eating disorder who are medically stable, determining the treatment setting requires a thorough general medical and psychiatric evaluation, and the decision about deposition rests upon assessment of the risk and benefits of each option. Treatment options usually include inpatient hospitalization, partial hospitalization day program, and outpatient care. In addition, residential care may be available. Clinical judgment and some degree of individuation is required. The choice is based upon the severity of illness as well as underlying or concurrent general medical and psychiatric disorder. Also, it depends. We ask questions about social support, about home environment, about whether the patient was abused or experienced any bullying. So it also matters when we look at the case, each case individually. We have to take into account every piece of information we have about this particular patient, and then based on these things we have to create our treatment plan. Also, there is stigma around eating disorders. People, maybe even this girl, she knew something is wrong with her, hopefully, if she has an insight, right? But she cannot stand, she cannot fight by herself with this condition. So, and she even doesn't know that there are many resources actually available to help her and to support her, and she can recover, and she can, complete a treatment course and live normal and fulfilled and wealthy and healthy life. Therefore, during our station, we can discuss with her nutritional rehabilitation. For some other cases, if there is a refeeding syndrome, how to manage refeeding syndrome, how to prevent it. Psychotherapy, the mainstream, as well as nutritional rehabilitation, because all this vomiting, when they take diuretics or laxatives, these are all coping mechanisms and strategies which are pathological, right? So cognitive behavioral therapy, for example, can help to develop normal, healthy coping mechanisms, right? Also, psychodynamic therapy, motivational interviewing, and if you have a counseling station and this kind of interviewing is appropriate, sorry, this is something you can consider to do during your counseling station. We already discussed family therapy. Pharmacotherapy in case of anorexia nervosa is not an initial or primary treatment. So this information I took from UpToDate, very recent update. As well, during this station, that can be included into the checklist, whether you gave your patient brochures, whether you determine this patient needs a social worker and you offer the help of social worker, especially if some family issues you found during the conversation. Offer social support groups, offer to connect your patient to social support groups, share useful links from the internet, and provide phone numbers where the patient can call and get an immediate help and support in case of need. Thank you very much for watching this video. I hope it is helpful and you'll get the highest score possible. You'll feel more confident during the day of your exam. It's an amazing exam overall. It helps to build your skills and to enter Canadian healthcare system. So practice, succeed and achieve. And thank you again.